More people are turning to telemedicine so they don't have to physically go into a doctor's office. Dr. Janice Johnston, Medical Director of Redirect Health, joining us live on the phone this morning. Good morning, Doctor.
Good morning.
Tell me a little bit about telemedicine and exactly how that works.
So telemedicine is something that we've been doing at Redirect Health for many years now. And it's a way to have an evaluation either over the phone or video with a medical provider to go over your symptoms, have some direction as to what you need, and often be able to be recommended treatment, prescribed medication, and give you some recommendations. This keeps you at home, in times that aren't during these times of coronavirus, could keep you at work as well, too, so you don't have to miss work and go to an office.
Yeah, the benefits, especially during an outbreak like this, seem obvious. But exactly how is it done? How are you able to diagnose, using these methods?
Right. So we listen to your symptoms and take a thorough history. We ask you questions about any chronic conditions that you may have, and based on symptoms, physicians are very capable of coming up with a very probable diagnosis and can recommend care from there. With Redirect Health, we have the ability to follow up on a next-day basis in an automated way so that we can tell is what we're doing helping, or do we need to change gears, recommend possibly an in-person evaluation from there. So it's an amazing tool, and I think telemedicine is going to come to the forefront of being a way to screen people and let people know what their next steps may be.
Dr. Johnston, I assume that there are many things that aren't able to be diagnosed remotely like this, but what are the main things that you're able to diagnose this way?
So it's important, when you start to feel ill, to get evaluated quickly. And we think that getting evaluated within the first, 48 hours of starting onset of symptoms, or even sooner than that, can often lead to getting you better, quicker, faster. So, putting corona and flu-like symptoms aside, things like I have a sore ear, I have pink eye, I have burning when I urinate, all the common kinds of things that we see on a regular basis are obviously still very common out there right now. Yeast infections, constipation, nausea, vomiting, even things like I have a chronic history of hypothyroidism, hypertension, diabetes, all the kind of, it basically can be used for a multitude of things. I know there's a lot of concern about corona. We still see flu as well, too. And so the symptoms, although they overlap, the nuances can be different, and there is treatment for influenza. So, if we feel like that's appropriate, we can put you on medication, and if we get you on within the first 48 hours, you can start to feel better quicker. So we feel like we're on the right track.
That makes sense.
And, in terms of, it'd be great to be able to test for all of these things, but that's not reality right now. So being able to have a consultation and get some direction so we can use our resources appropriately, I think is telemedicine is key for that.
Yeah, and maybe get you to that next step, too, when we're talking about coronavirus specifically. Dr. Janice Johnston, thank you so much for being with us this morning.